Tonight, a TV6 investigation into a controversial contraceptive hundreds of women using a permanent form of birth control.
A group of QCA women have come forward willing to share their Essure stories, telling us their #1 priority is to get this medical device off the market.
KWQC's Amber O'Brien investigates.
The Essure device is a pair of metal coils designed to be inserted or implanted into a woman's fallopian tubes, kind of like you see right here. It's also a permanent form of birth control. After several months, scar tissue will build up around the coils and then creates barriers to prevent pregnancy. The problem, according to those who complain about Essure, is that the device can cause severe pain, irritation, headaches, and forgetfulness. And that's just to name a few.
It didn't hit me full on until this year.
It's an emotional process for women dealing with Essure. Many of these Quad Cities women were in tears as they told me their stories. Marcia Sampson had the Essure procedure in August of 2011. A few months prior, she had her 4th child and was ready to be done.
I have 4 kids, ages 20 to 2, and I also have 2 stepchildren. We didn't want any more kids.
Instead of getting her tubes tied, she says her doctor recommended Essure. It cost about $300 compared to a $1,000 tubal surgery. But when Marcia first read about Essure, she had concerns.
He's like, well, there's a great product out there. It's called Essure, you know, and he told me all the great things. And I grabbed the pamphlet, and I'm like, well, it says if anybody has a nickel allergy, they shouldn't get it.
Marcia consulted an Essure rep and her current doctor about her known nickel allergy. They both assured her she would be fine.
I called the doctor after the nurse talked to me, and I said, I have a known nickel allergy. I do not think I will be fine. And he says, well, if the FDA took the warning off the label and the rep says you'll be fine, you'll be fine.
At that point, Marcia decided to trust her doctor.
On August 8th, I went in for my placement. It was like October when everything really hit me.
Those we talked to with Essure describe the pain as barbed wire in their reproductive systems.
My immediate symptoms were the pelvic pain and the back aches. It just made my body go haywire. The migraines I had before Essure were nothing. I started getting up to 20 a month.
According to the FDA, there have been well over 900 reports of injuries, complications, or problems related to Essure. 600 reports of pain, 140 reports of bleeding, and 116 reports of the device migrating or moving within the body. And that's just to name a few. Another QCA woman, Amanda Dykman, can add to the list.
Chronic fatigue, weight gain, migraines, back pain, the list goes on of how I felt. I just felt like literally all of my energy was just drained out of me. I could barely get out of bed.
Like Marcia, Amanda was ready to stop having kids. Her doctor recommended Essure as a minimally invasive procedure with no recovery time. To Amanda, this sounded like the perfect option.
I woke up and I felt great, and I'm like, wow, you know, this is wonderful. I felt awesome. I endorsed it to begin with, you know. But as time went by, I started to notice different changes about myself.
She wasn't pregnant, and her doctor just told her to work out.
When I first started getting suspicions if it was normal, I said, could I be like retaining water from anything? Because it was like hard. It really made me bloat up and just turned me into somebody I didn't want to be.
Hundreds of women nationwide suffering from similar symptoms have opted for full hysterectomy to get rid of the coils. Marcia and Amanda did the same.
The best day of my life. I just wanted to do cartwheels down the hall of the hospital.
Amanda has been Essure free for about 6 months.
I haven't had one headache since May 15th. I have not felt dizzy once. Everything is just so much better.
But doctors we spoke to tell us they cannot directly associate symptoms like pain, dizziness, headaches to Essure.
I don't know that any birth control, temporary or permanent, particularly causes these things. I think they just happen in some people. Not that they aren't real and important symptoms, but they're probably not caused by their sterilization procedure.
After their hysterectomies, Amanda and Marcia tell us their doctors have no explanation for their symptoms, and they won't say Essure is the cause.
He never said it was the problem.
I saw an OB in Galesburg and it couldn't be Essure. I kept hitting this dead-end cycle of trying to find a doctor that would believe me.
And then we brought this issue to the manufacturer, Bayer. Bayer denied numerous requests for an interview but gave us this response. At Bayer, we care about our patients and take the safety of our products very seriously. We are saddened to hear of any serious health condition affecting a patient using one of our products, irrespective of the cause. Essure was approved by the FDA in 2002. Over 750,000 women worldwide rely on Essure, but these women in the QCA are hoping that number drops significantly.
I don't want to see anybody else going through this. This has just been a living nightmare.
In Davenport, Amber O'Brien, KWQC, TV6 News.